Hey, Airport Fire, it's Dr. Mackey. Starting up with the next policy. This is 5052 trauma destination, but I'm going to start with a review of trauma triage criteria because I think this is important. This is something we have to have nailed down in our brain. Remember, there are three major boxes in the trauma triage criteria. The first one is physiologic. That's the big three, the GCS, systolic blood pressure, and respiratory rate. Make sure you know those. Heart rate is not part of that. The next box down, if they don't meet that and they have traumatic injury, to be a critical trauma patient, you have to meet an anatomic criteria. So that's the penetrating injuries, flailed chest, amputations, placement of a tourniquet, pelvic fractures, things like that. So anatomic is after physiologic. And then finally, there's mechanism of injury. These are the falls, high-risk auto crashes, auto peds, ejection from vehicles or livestock. But there is one final criteria to talk about, and that's your provider judgment. Here's some obvious ones, right? They're taking anticoagulants. There's a definite loss of consciousness. They're pregnant. They got in trauma into a traumatic injury. So those patients would go to a trauma center, and that would be based upon your judgment. Okay, let's jump to destination. So by definition, one of those patients, it meets one of those three criteria that we talked about, anatomic, physiologic, mechanism, and then also provider judgment. They're critical trauma patients. They go to trauma centers. And the destination policy protocol is a bit lengthy, but it's pretty self-explanatory. All patients meeting trauma triage criteria are going to go to trauma centers. And there are some special categories. Kids is one special category. In our county, or less than or equal to 14 years of age, is by definition a pediatric patient. If they meet trauma triage criteria, they go to UC Davis. If a pediatric trauma patient is under CPR, they should go to the time closest trauma center. If they don't have an effective airway, they just go to the closest hospital. Doesn't matter if they're a trauma center or not. And if UC Davis is closed to trauma patients, which is very rare, but it does happen, they should be taken to the time closest trauma center. Finally, if a child has a tourniquet in place, remember before that met critical trauma patient criteria, and those patients are going to go to a trauma center, and if it's a child, they're going to go to UC Davis. So this is just a reminder again that all adults go to trauma centers that have tourniquets in place. And then also the reminder about base contact. If a patient's not going to go to a trauma center that should, so they refuse to, or they're too unstable to, make base contact, cover yourself, call base, call a trauma center, and let them know that you have a critical trauma patient that is not going to make it to a trauma center so that the other hospital can get ready to go. Okay. All right, guys, that may have created some confusion. Of course, we're going to talk about a lot of this. If you have questions, never hesitate. Please reach out. Take care.